If someone's woman's not feeling well, there's plenty that can be done. I've had a lot of patients, by the time they get to me, they've been told all sorts of horrible things. They've been told what I call the J word. You're just getting older. You just have to live with it. They've been told that they just have to eat less and exercise more. Or they've been told these types of dismissive things. Very common is, well, you're still having your period, so it can't be your hormones.
Welcome to The Whole View. I'm Stacy Toth of Real Everything, and I'm here each week to dive deeper into how we can find happiness and health inside and out through self-love, body positivity, and discovering new ways to be our best selves. Before we get started, a reminder that this podcast is for educational purposes and is not intended to diagnose, advise, or treat any physical or mental illness. And while Dr. Liz is an OBGYN, she is not your doctor. And we always recommend that you see a licensed health professional accordingly. Dr. Liz Lyster is an OBGYN medical doctor, best-selling author, and speaker, and an expert in perimenopause and menopause. So obviously that'll be our topic today. And in San Francisco area, she helps women and men in midlife and beyond have more energy, increase motivation, generally feel great, and graduated from Cornell University. Kudos there. Went to medical school at UC Irvine and has her master's degree at UCLA in common health education. And a little bit of a jaw-dropping moment for everyone. Dr. Liz walks her own talk. When she turned 50 a few years ago, she celebrated by climbing to the top of Mount Kilimanjaro in Africa. Like, I just blew my mind. I was super impressed. And you're also the founder of the Miracle of Menopause Women's Network, which we'll talk about a little bit later too. Welcome so much to The Whole View. I'm excited you're here. Can you tell us a little bit more about yourself? Maybe a fun fact I didn't know or something I missed?
Okay, well, we'll get some probably facts that are more fun as we go. But I think to start us off, when you just did, of course, I know this phrase, walk my own talk. I went into menopause when I was 43. And I'm getting ready to turn 60 next year. So I have really been at this menopause thing a really long time from a personal standpoint, as well as from the doctor side of things. I had my kids in my 30s, which was funny because I lived in LA and I was the old lady. Everybody else was in their, all the other mommies were in their 20s. And then I moved further south to Orange County, California, and then I was the baby. All the moms were older than me. Very interesting. So all of those experiences have informed my interests and my joy. I love what I do. It's super fun. I'm basically talking with women most of the time.
So fun fact for everybody. It is actually my 43rd birthday today.
Happy birthday.
Thank you. And there was an article based on a new study that came out that is saying that there are bursts of aging, age-related changes at around the ages of 44 and then again at 60. And the articles and studies consistently say like mid-40s. And so for me, the fact that they're using the number 44 as I'm entering my 44th year, we're going to have this conversation because this show is nothing else if not my own personal research and advice tool here. So Liz, I'm going to ask you a bunch of questions and lean into that. But I think before we jump in on that front, maybe we could just talk a little bit and baseline on what I like to call second puberty. I specifically call it that because I think that there's a lot more that goes into it than just you stop menstruating or your menstruation cycle changes. And I think as a younger person who menstruated, that is what I thought. Like you hear about hot flashes, and I think even as a younger person. I would just roll my eyes like, "Ugh, people, whatever." There was no education or real understanding around the
Right.
true physical changes and how they impact you. So it also feels like that is a cultural shift right now. So, for example, the study does talk about were these menopause type changes that people saw at 44 influencing what we're seeing, or was it other things? Trying to parse that out. But it's not just this study, like on TikTok, on Instagram. I don't know. It feels culturally okay for me to say the words perimenopause or menopause around people in society, whereas I don't think that was really a thing like decades ago. I think that it was very hush
Correct.
hush. So I'm wondering if maybe
Correct.
it could just like shed some light because you've been doing this a while, right? Like, what is up with all of these changes and what even is perimenopause and menopause for people who are listening and don't quite understand the difference and they're not yet in the bubble I'm in.
Got you. Got you. Well, half of women, adult women in the US are over age 35. So that's a big audience that needs to pay attention to our discussion today. I always think it's easier to do it backwards. I'll say what menopause is and then perimenopause. Menopause, the way I define it, really simple. It happens under one of two circumstances, either 12 months without your period. There's a little more that goes with that. Or if a woman has her ovaries removed, then she's put into what we call surgical menopause. So that's menopause. And the way I use the word, I use menopause and postmenopause interchangeably. So the way I speak it is once you go into menopause, you're in menopause, hopefully for a long time that you have a nice long life. Perimenopause can be 10 or more years leading up to that point of going into menopause. And I say or more because there's so many changes in our environment. I see women going through hormonal changes younger and younger. Okay, so, and you're absolutely right. It's a very big mixed bag of how women feel. So we can come back and talk more about that. I definitely think it's a cultural shift that's happening. I went into menopause age 43. That was in 2009. And it really was not the topic of conversation. There was one doctor, Christiane Northrup, and the one, she was it. She was on Oprah. She was writing books. And now she's really moved on. A lot of women, you're in your 40s, I'm in my 50s. A lot of women our age have never even heard of her. But women older than me, like in their 60s and 70s, the vast majority have heard of her. So it's like this demarcation of interesting. And now there's lots of celebrities that are entering this phase. They're turning 50 and they're out there and they're talking about it. We're advocating for ourselves, we're advocating for more research funding. So it's definitely not our imagination. I definitely think it's more of a discussion and more definitely it was hush before. My mom went through crazy stuff in her 30s, very hush, ended up with a hysterectomy and ovaries removed in her 30s. And that was a long time ago. So no question that it's coming out into the open, which of course is always a good thing.
It's interesting. My grandmother had a full hysterectomy early on. I think she was probably in her early 20s because my mom and her sister are both adopted. And she didn't have any hormone replacement therapy or anything. And my mom tells stories about her not being well, like mentally not
Wow.
being well. And I think back
Wow.
to how very different that is from how things are handled today. And
Yeah.
that's I guess technically that's 2 generations, but that's like in my lifetime, that's not that long ago, right? So,
Right.
yeah, I think what's interesting too is this idea that women's health specifically was not considered in medical literature or education around health things for so long because it was like, oh, we can't include women in studies because their hormones change. So we're just going to exclude them
Right.
from everything.
They
Past
might be
ovulation.
right. Yeah, they might get pregnant or they might, that's exactly right.
Yeah.
Hmm. Yeah, really
And
kind of lame. Yeah,
so it's really, I previously did a show on this. It's really modern times that we have started to change that and to include more women's health in general medical studies and things. And we're learning, oh, the things that we thought were good for everybody really are good for men and not necessarily good for women, et cetera, et
right,
cetera. Uh,
right. We are not small men. That's the phrase that goes around in the medical world.
exactly. Yes.
Yes.
So I think, as it seems to me like what happened in a good way is that with that realization, it opened the onion a little bit. And now we're peeling back like all the different layers and all the things that we need to learn. And we can talk about how, as you're saying, there's a huge amount of the population who are either in perimenopause or menopause in general. And we need to educate about what that means about health. If it increases your risk of cardiovascular disease or different kinds of things, then like, why aren't we having those discussions? So I am excited to talk about that today. I I also just want to pause before we get fully into it and name I am the mother of a trans child, and we're going to be using the phrase woman. We already have a lot, and I want to acknowledge that not all women menstruate and not all people who menstruate are women. It is a general term that I'm sure we'll use, but I also want to just acknowledge I will, as intermittently, refer to the phrase of like menstruating person and different kinds of things. And
Woman, and I really mean, I've heard other people use the phrase vulva owner, or depending on what organ we're talking about specifically. But yeah, I appreciate that. Thank you for doing that.
okay, so you've been doing this a long time. We talked about. I sent you the article. You took a small peek at it before we started the
Yeah, I
show.
had seen it. I had seen the headline.
It's making its rounds. So for listeners, this article just came out, I don't know, like maybe last month. Um, but it is going around right now on social media of the fact that a study has found that there are two bursts of time when people have significant jumps in their aging. So they found that the age 44, and for me, that's today, I'm entering my 44th year, and 60 appear to be these periods of time where people jump in their aging. And specifically, they talked about in this study how it had to do with basically microbiome, all the different kinds of things that we've talked about. Our little friends, as we call them, our little pets in our guts and on our skin and all these things that they are drivers for change at these times. But there's also so many other things that go into change at these times, as we mentioned, perimenopause. So I'm
Yes.
curious, Dr. Liz, you read this article. What is your takeaway?
Okay, so first of all, this is what we call, okay, it's actually more scientific than most epidemiologic studies, but an epidemiologic study is distinguished by the fact that they're not looking at the causes. They're observing the changes. So that's really important. And people will take this information and run with it in that way. They'll say, okay, this is what we saw. We saw these microbes shift and change. Now let's look at why that's happening. All right. So for me, so a couple of things. Another thing that they mention in the discussion is that they said, well, for women in their 40s, could it be their hormones? No, it's probably not, because it also happened with men around that same time. Let's inform your listeners. Men go through hormone changes too. For women, here's my little brief summary. For women, on average, in our 30s, our progesterone starts to decline, and in our 40s, our estrogen starts to fluctuate. And during all that time, after about age 20, that's when everything's peak levels of hormones, then things are gradually declining for a variety of other hormones, such as testosterone, DHEA, growth hormone, melatonin. A lot of others are changing. And men go through those changes too. For men, it's a little less obvious because they don't have a menstrual cycle to indicate that things are off. So it's the gradual. Do you know the story of the boiling frog?
Oh, yes,
It
yes.
yeah, okay, yeah, it's kinda
You're put in
gross
warm water and it feels fine and then becomes
until it's too late.
yes.
Exactly. Gradually heat the water, it doesn't notice. That's what the men are going through. Okay. My husband's very hilarious. He's always being my flag waver and cheerleader and going around telling all his colleagues, all his men colleagues to don't be the boiling frog. Okay. So they're definitely going through changes as well. All right. So age 40s, to my hormonal point of view of looking at things, is when there is we'll call it a confluence of different factors. There's also different stressors happening at that point, which affects adrenals, thyroid, and the gut, and not in that order. They all affect each other. Mid 40s is an interesting time for a lot of adults from a kid and parenting standpoint, whether they're giving birth or not. Then, well, let's see, career wise, it's an interesting point. A lot of people are doing a lot of soul searching at this time. So for me, and hormones influence that. Estrogen helps with depression, progesterone helps with anxiety. And we're not even talking about all the craziness in the world. All right. So that's mid 40s. That's how I view that. Then the early 60s, same thing, especially for women. I'll go back and look at more of what they saw with the men at that older age. But for women, especially if they don't do anything to help their hormonal balance, then average age of menopause is 51. And by a decade later, a lot of changes have set in without those hormones around for the women. So to me, that made perfect sense as well.
It's interesting to think about the lifestyle changes as well incorporating into it because I think for me, I had my children early. I had my children throughout my 20s. And because that's that peak hormonal kind of stage, right?
Yeah.
I think it didn't hit my body as hard as now my teenagers. I have two teenagers that are now legal adults, and I have two in high school, one of whom drives the other to high school. And it's like the amount of stress that I have around knowing that my children are now out in the world and like need to get jobs and are legally responsible. If something happens, they could go to jail. They could like do all these
Yep.
things.
Oh, you're
Um,
giving me chills. Yep.
I know that is a kind of internalized stress that
That's
I don't think a lot of us are really thinking about how
that's right.
much it impacts our overall wellness.
That's exactly right. One of the ways I like to describe that is we're strong people. We're doing what we need to do to cope with all of that. And while we're doing that coping, our bodies still take the hit. Our cells still absorb what I refer to as physiologic stress. That's really important for hormonal disruption. It's really important for adrenals and thyroid. Okay, I checked my own cortisol recently and it was really high. And I'm thinking, okay, I know what to do about this. My friends have no sympathy for me. They're like, we know a good hormone doctor. You can see they tease me. But anyhow, I don't feel stressed out. I feel good. And that's what the numbers show. So I have to do what I need to do to take care of the package, the cells.
Okay, so let's talk about that. You're talking about some of these hormone changes. But there's a lot that is physically changing, and there are a huge, vast variety of symptoms that might be reflected. And so you're saying, I feel good, but my numbers are this. There's also like, could my ears itch any more? Good gravy. What is happening? So can we talk? And I've talked to a lot of people who are like, I am so stinky, right? Like perimenopause, like all of a sudden you're back to being a gross teenager with BO if you don't like properly I use natural non-toxic deodorant, so that doesn't help either, right? Like, I have to layer up multiple times a day. What are some of these symptoms that people can say, "Oh, that's why that's happening," and maybe some symptoms that we're not even aware of?
Yeah, absolutely. This is really important. First, we can start with the ones that people do tend to know about: hot flashes, night sweats. That can be either from estrogen fluctuating or from cortisol fluctuating, the stress hormone. So those are the couple that people really know about. A little starting in the direction of lesser known, sleep disruption is really common and very important to address. Mood changes. Women come to me, they try to talk with their regular doctor, and the doctor wants to give them what I call a Band-Aid medication, which is like an antidepressant or a sleeping pill. And by the time they get to me, they say, I know I'm not depressed. This is not depression. I have a family member. They're depressed. I know what that looks like. That's not what I'm feeling. So mood changes, sleep disruption, again, these all relate to each other. Weight gain, despite doing everything the same, there's no question we go through metabolic changes as we go through these phases and get older. Let's see, brain fog, another common one. And again, I was talking about how we're at this career point in our lives, in our 40s and 50s and even 60s, and we need our brain firing on all cylinders, so that changes. Those are the most common ones. Dryness. So when you talk about your ears itching, I'm thinking of, it reminded me women experience dry eyes. Of course, all the vaginal dryness, which isn't really dryness, it's a loss of elasticity. That's why it hurts. Libido changes. Again, funny how I have to remind women that it is normal to not want to do something that hurts. So if they're having discomfort with sex, it's not a mystery to have less sex drive, right? But there's other things. Libido is not only about sex. So there's motivation and drive. And women talk about that. I used to love going to do whatever, going out with friends or going to the gym or whatever it may be. And now I just feel like can't be bothered to get up off the couch, and that's not me. Those are, I'm sure, will trigger me to think of many more. Hair changes, that I'll think of more as we go, but those are the big common ones.
It's interesting when you were talking about lack of motivation. It reminded me that one of the biggest things that I've noticed, and I'm curious how this manifests and shows up for you when you're talking with people, is that my cycle is much more bold in the phases of my menstrual cycle. So when I am in my follicular cycle versus when I'm in my luteal phase, I would not have even known that previously. I knew when I was ovulating because I could physically see signs. And also, there's something dangerously pheromonal between my husband and he can detect like my ovulation in like a disturbing sort of way. So my whole life, I've known when I'm ovulating and I have a very steady cycle. I
Okay.
didn't even know what a luteal phase or a follicular phase was. And now I'm like guns blazing, super creative and getting all the things done. And then 2 weeks later, I'm like, it's all I can do to watch reality TV on the sofa right now. Can you talk a little bit about why, like, going through this second puberty would heighten some of these hormonal shifts throughout our menstrual cycle?
Yeah, absolutely. I love that. That's such a you give great visuals as well. I want to make a quick point of something we said a few minutes ago about studies not including women because of hormonal changes. We do have hormonal changes. So I feel as though we're coming full circle. I've been listening and learning and studying with a doctor who her specialty is basically advising elite female athletes because they have to train differently depending on where they are in their cycle. So for sure, there are differences. Now, not speaking to you personally of how you experience those differences, but generally speaking, the follicular phase is the first part of the cycle. And we like to use those words because it refers to what's happening in the ovaries. So a woman who's not having her period, she may not have a menstrual cycle, but she might still have an ovarian cycle, right? So the first phase is dominated with the development of the follicle. and estrogen is the hormone of the moment in that first half. And then in the second half, it's more of that's the luteal phase, like you mentioned. And that's more where progesterone is being produced. Hopefully, these levels change. Their ratios to each other can change. As women go into their 40s, it's very common to not make enough progesterone in that luteal phase. And then she can have what we refer to as estrogen dominance, where not that she necessarily is making too much estrogen, but it's not in a good balance with the progesterone in that second half. Then, if the body does not detect pregnancy, because pregnancy, in other words, the follicle releases an egg that gets fertilized, and then pregnancy causes the progesterone to continue. So when that doesn't happen, it drops off, and then we have our period. Estrogen causes cells to hold on to fluid. It causes better fat metabolism. The luteal phase, progesterone, as the name implies, is for the preparation for pregnancy, and it causes the cells to, it is a natural diuretic, so it's the opposite of the balancing for the estrogen, and also promotes, it decreases fat metabolism. So our female bodies are designed, whether we make babies or not, we're designed to make the babies. So holding on to the weight. Then that's what women, when they experience PMS types of symptoms, it's the drop off in progesterone that's usually leading to the anxiety. They could have breast tenderness. They can have other kinds of symptoms that are happening, and that'll be due to the drop off usually in progesterone. And that's when the cycle's regular. Then things get irregular as we go into our 40s.
So when things start to become a little irregular, so for me, I started noticing that super solid, predictable path that I had was no longer so. And at first it was like, is this stress? Is this what's happening? And then it would be like, oh, I just went 6 weeks without menstruating. And now I went 3 weeks and I menstruated. This is not stress. This is something else. Right.
Yeah.
So,
Yeah.
how does that change up, right? Like the
Yeah.
complete irregularity affect how we're feeling through those cycles, and why do they feel more intense?
All right. Yes. So I wanted to circle back to that. Other hormones are also changing. So let me talk for a second about growth hormone. Growth hormone is highest when we are teenagers because that's when we're mostly growing. That we measure it with a test called IGF-1. It's a marker for growth. There's others, but that's a main test that we can do. And just to give you a reference point, teenagers can have IGF-1 levels 400, 500, 600, really high, right? And then we are done growing. And then our body, it levels off and then it tapers off what our body makes in terms of quantity of growth hormone. And we make growth hormone with exercise and we make it while we sleep. So all of that is very important and relevant to what we're talking about. Growth hormone, after we're done growing, is still important. It's a cell repair hormone. And it gives what I refer to as a buffer. Okay, when we're 20, we can not get good sleep, not eat great, and still perform. Pull all-nighters in college or wherever, whatever we needed to do to study or whatever we were doing, and we can still function. And that buffer, that leeway goes down as we get older. And what else is going down? Growth hormone. Okay, I like adults to be hopefully IGF-1 levels close to 200, but I often measure them when a woman or a man gets to be in his 40s or 50s. The levels are really dropping. It's closer to 100. Sometimes it's even below 100. And as I mentioned, it's a cell repair hormone. So this is also relevant to that other discussion we were talking about with that study of these all of a sudden spurts of aging spurts. We do need more terminology for getting older, right? We have all these terms for born, when the day we're born through age 18 or so, and then we're just adult.
We're just old.
Okay, we're getting older if we're lucky, as I like to say,
Mhm.
but we do need more terminology. So maybe this study that you're bringing up will help accelerate that. We shall see. So that's one of that's why I think that there's just less leeway in all the things that we do, less of this buffer between what's happening and what we're experiencing.
Interesting. I hear you talking about how you're testing the human growth hormone, you're testing, I'm assuming, estrogen and progesterone and different kinds of things.
Yeah.
When I talk to my doctors about these things, it's like I'm literally teaching them because they're like, well, this hormone. I'm like, but you didn't even ask me where I was in my cycle. Like, how do you know where this hormone is supposed to be if you don't even know like which phase of my cycle I'm in? Can you talk a little bit about
Yeah.
the lack of knowledge that most doctors
Ugh.
have and maybe like what we need to be aware of and try to find a good one?
Yeah, absolutely. It is such a challenge. I remember when the internet first was a thing and when my patients started bringing me articles. It wasn't like they could just email me a link to look at. They would print articles and bring them in. And I was always interested. So that's also been, I have a good relationship with the internet, generally speaking. And I always caution people, of course, people are going to look things up online, but I always like to say, I've never seen anybody go online and feel better. So it always has to be done with a good dose of caution. Okay. So there was a study done a while back that showed an average delay between doctors learning new information and implementing it in clinical practice of an average of 17 years. This crazy huge delay. So there's that. And I've experienced that. I've been my medical training, medical school, residency, and we learn probably still most of what we learn from the people who teach us. So their biases are very relevant to what we learn. So right now, there's an entire generation of doctors operating under bad information that came from a study called the Women's Health Initiative, which began publishing findings in 2002, over 20 years ago. And that's where the understanding that hormones are dangerous really has come from that study. And that study had so many flaws. It studied, to the point of this other article, women who were not having any symptoms, because you can't run a randomized study if a person's having symptoms. Then they'll know what group they're in. So these were women who were 10 or more years on average into menopause that were studied after the changes without the hormones already kicked in. So wrong women studied, wrong hormones. They used a horse-based estrogen, and they used a progestin that's not what human ovaries make. We make progesterone, but they used a progestin. So we know that's the wrong hormones and wrong route of administration. So we now know that when you give estrogen orally, there's more possibility of chances of going to the liver, stimulating the production of clotting factors, and that led to some cardiovascular issues in that study. So when we use estrogen through the skin, we're going to be okay. So we've really learned a lot. We've got this whole generation of doctors. The North American Menopause Society is striving. They're doing good. They're publishing. They publish an updated position statement every 5 years. The last one was in 2022. And so every time they publish this statement, they review the literature in great detail and they make statements that those of us who do like the practice I've been doing for a long time, we already knew these things, but at least they're bringing it to the mainstream so that doctors can do better. But you're absolutely right. It's a big problem.
I'd never heard, I had heard multiple times that study was flawed and outdated. And this is not our first menopause show here either. We talked about the benefits, the health benefits of hormone replacement therapy, especially when done right. And had heard even if you have a history of breast cancer in your family, it could be the right thing for you. It could actually reduce your risk, but had not actually heard some of the breakdown of like where that came from or why it was wrong. I'm curious where you would recommend people try to find someone who is keeping up with these things, who is on the forefront and could help them in an appropriate way to go through this second puberty. I don't want to call it the change of life. Like that sounds ridiculous, like, and I don't know, it makes me feel like an 80-year-old grandma to be like, "I'm going through the change of life." No, I'm going through second puberty, and everyone around me needs to be nice before I bite off their head sometimes, and sometimes I just wanna snuggle everybody and everything's great. Like, and they just need to understand that's what's happening to me. Like,
That
I
does get better. It does smooth out. You're making me think of another. I'm going to send you this graph so you can include it. So I'll ask you how you
sure.
can include it so people can have access to it. But basically, it's showing all these high hormone levels when we're in our 20s, let's say, and maybe into our 30s. Progesterone declines first, then estrogen. Testosterone's doing this gradual decline the whole time. But as women go towards the transition into that's what we call it, the menopause transition, it really looks like up, down, up, down. I call it the stock market phase because that is what it looks like. So I'm laughing because it goes along with what you're describing,
Well,
right?
yes, listen, I have 4 teenagers.
Right.
Cannot give me a hard time because they're like, listen, this house,
But
my poor husband, like between me and the 4 teenagers. Anyway, okay, finding a good care provider. Let's move on.
right. Okay. So it's really, so I always tell people to start with the list that you can do with your insurance and you make some calls. You got to just be at your desk and able to spend a little bit of time on it because you don't always reach people right away. And how the office staff treats you is also relevant and important because even if you find a great doctor who you really like, but their staff isn't responsive, that's going to be frustrating. So ideally, you want to have good staff interactions as well as a doctor who is going to do the basics, do what they're there to do, as far as I'm concerned. Listen, answer questions. And there are ways to be a savvy patient and arrive with questions ready. Lots of other studies show that doctors don't bring up sensitive subjects unless the patient does. Also, a lot of regular doctors who are on normal insurance are short on time. That's that was the number one factor that led me to leave the insurance world. It was really hard for me because I really want people to be able to use. I want them to have insurance and I want them to be able to use it. I no longer bill insurance because it just became just that restrictive. I'm now free of those restrictions. And when I work with patients, they are also when they're working with me. My visits average anywhere from 45 minutes up to an hour and a half. But regular doctors in a normal world they don't have that kind of time. So there's ways to be prepared to make the most of those few minutes.
So when someone is calling, what questions would you suggest they ask?
That's a really good question. And I'm going to think about this and I'm going to add it. So, first of all, just the demeanor of the people who answer. That's really a lot of what I mean when how is the staff doing? First of all, I recommend getting in with a doctor. It's always better to be an established patient if you need something. You don't want to be a new patient. So if you're in a new area or your doctor retired, huge wave of doctors retiring since the pandemic, then go find another doctor, even if they're not exactly your favorite person yet. It's better to be an established patient rather than a new patient. Other questions really have to do with how the person is feeling, Stacy. If someone's feeling okay, then that's fine. My gyno, she's not the greatest for bedside manner, but she's fabulous from a technical standpoint, and that's good for me. That works for me. So beyond that, for me, it's not so much the questions as what is your experience when you're dealing with the staff and at the office. It's really more that. And obviously not being gaslit. All right. If woman's not feeling well, there's plenty that can be done. I've had a lot of patients, by the time they get to me, they've been told all sorts of horrible things. They've been told what I call the J word. You're just getting older. You just have to live with it. They've been told that they just have to eat less and exercise more, or they've been told these types of dismissive things. Very common is, well, you're still having your period, so it can't be your hormones. So any of those things, like, not the greatest candidate. One of my dreams is to do some kind of vetting process so that women can know in advance what they're dealing with. I haven't gotten that far yet. I'm still busy helping people feel better.
For me, as a woman of size, I also would recommend that people read reviews online. Take them with a grain of salt, right? Like knowing that some people go to the internet because they were having a bad day and they're taking it out on someone else. I can tell the difference between someone
Yes.
who is saying that they had a genuine concern versus someone who is like,
Ranting.
I'm venting.
Yes.
Um, but there are resources out there that have been compiled of doctors who are size inclusive and they're going to be non-medically biased when it comes to your weight, right? Like there are horror stories of
I
people
love
who
that.
like come in with with a broken arm and the doctor's like, "Well, you should lose weight." You know,
Right.
so
Right.
there's a
Yeah.
lot of different things like that. And so I think that for me, it's also the same kind of thought process when I'm thinking about my OBGYN. I also was looking for someone who would feel like I wasn't going to be gaslit and that I wasn't going to be receiving medical bias, but I also want someone in my personal experience who has access and resources to things that when I might be ready for hormone replacement therapy, that
Yeah.
it is something that they're willing to do and that they have experience doing. Like, I don't want to be working with someone who's like, maybe throwing something at it because they're not super familiar, right? So I either want to be
Right.
working with someone like you, Liz, or I want to be working with a practice that is large enough that they have resources and experience within the practice that
Yeah.
I know if there's something weird with me that they'll have enough knowledge within that space to be able to support me.
Yeah.
So
Yeah.
it
That's
is
ideal.
difficult. I get so many questions from people asking me where do I go to see my doctors. And I think that this is such a challenge for people because
Yeah.
I don't feel comfortable telling people where I go to a doctor. I don't know. It just feels personal. It's not like I think anybody's going to
Yeah.
be waiting for me in the waiting room or breaking in and looking at my medical
Right.
records or anything. But I think there's just, I don't know, there's like a personal boundary there that I want to draw. But
Sure.
I think that there are ways that people can go about researching the same way that I went about researching to find what will work for them in their area. And there are definitely people like you who specialize in this. And I can also think of like, I've had a endocrinologist who is in New York, who if I had problems in that area, like I would consult with a real specialist person if I
Yeah.
could find someone in my area to meet my needs. Because I
Yeah.
just think that of all the things in your life, I know that it's super overwhelming to sit down at your desk and call companies for 3 hours
Right.
or to, like, research these people and read a bunch of bad reviews, but, like, your health is literally the most important thing in your life. It could that 3 hours that you spend could be adding 20 years to your life if you do it the right way. And so I just want to really
Yeah,
encourage people
that's
to like
great.
do that, to find the time and to make the effort.
Yeah. So that's really great. I heard you say a few things that you ask once you're there. Do you have any other things that people can ask in advance before they even make an appointment? I haven't done that myself. If I'm trying out someone new, I'm just trying them out.
Yeah, I think
Is there
it's
anything
more
else?
just the review process is
Okay.
the thing
Yep.
that I do beforehand so that I'm not wasting my time booking an appointment, going in, having the conversation, then being like, and for me,
Right.
I've personally had some serious medical trauma from previous misdiagnoses and different kinds of things. I was a competitive athlete with dehydration and it was completely missed because it was assumed
Mm,
that I could not be exercising, right? And so there are some things that I've had personal experiences with that have also led me to just be a little more aware and informed. And I think part of that is bio individual to the unique experiences that we've all had.
yes.
I have never had an experience where I've had a nightmare PAP or been denied, for example, pain medication for an IUD because I've never had an IUD. But if I'd had those experiences, I would be researching those kinds of things because that would be important to me to make sure that I was working with a provider that would
Yeah.
have care in that area. So I think it's
Yeah.
really
That's
just
great.
about the individual needs that the person has and researching that.
I agree.
Okay, so one of the things that would be super helpful is thinking about this proactive period. So I said when I'm ready to go on hormone replacement therapy. But now that I know that I'm about to hit this burst, I'm laughing every time I say this, but it's a scientific study that says that I'm literally about to hit an aging burst. I'm curious if there is almost like a preemptive, proactive approach to hormone replacement therapy or different kinds of wellness plan type things other than, yes, sleep. And we can talk about that a little bit, right? But like if I'm doing those things, am I is it almost better to start things proactively, or do you get yourself into a place where you are then seeing the hormone changes and you're almost like, to me, I'm like, am I digging myself too deep and then it's harder to get back out versus, but do you need to wait until you see the fluctuations to bring them back up? Am I making sense? Like, which is
Yeah.
better in terms of when to get into some of these additional supports?
Okay. I love it. I'm thinking about this in terms of that buffer that I was saying, that we have less of it as we get older. And by the way, I think getting older is awesome and a privilege, and it has so many gifts that I love talking about that too, versus all of there's lots of discussion, very important. We need to take care of the things that are not going right, but also look at the benefits, right? You got your kids and then you get to plan for what are you going to go do, and you're still going to be relatively young in the whole process of life. So I have lots of stories of younger moms. Anyway, so that's all good and that's all fun. So let's see. Being proactive, absolutely. And I always start with emphasizing sleep. So important. I also have a lot of women in their 40s and 50s who have little kids, and she's in her 50s and they got menopause and puberty in the same house. Okay. So that's all relevant and important. So protecting our sleep. I've had countless conversations with women where I always ask if there's a little kid in the house, how are they sleeping? All right. And the whole idea of, well, they need me during the night. Well, actually, they need to learn to sleep and you need to get your good sleep. So I always start with that. It's such a foundation for health, brain health, body healing and recovery. Absolutely critical. After that, I would say that being aware of the different symptoms that have hormonal underpinnings. So, including sleep. disruption, also anxiety. A lot of women describe feeling anxious for no clear reason. They are, my friend refers to it as afraid to cross the street. Something very simple, which you've done your whole life. You obviously know how to do it, but all of a sudden you're having misgivings and worry related to it. Progesterone can be so helpful. So again, for me, having a low threshold for using the right types of hormones to feel better, right? I like to use the word bioidentical. Bioidentical, all it means is that the hormones are the same as what the body used to make plenty of. And now those levels are changing. So we want to keep things bioidentical, lowest doses to be able to feel better, to be able to sleep. Diet, of course, what we eat, very important. It's really a challenge. I know that you've talked about this a lot on your show, and it's very important. It can be a little discouraging to realize everything with the food industry. A lot of the women I take care of, they've observed it, traveling in other countries and eating things that had no impact, no weight impact, they feel fine, but then eating those same things in the US, it's a bit of a mess. So that's a big challenge. So we have to, again, we've got less of a buffer, so we have to pay more attention to that. Increasing our protein and increasing our strength exercise. I am a lifelong aerobics girl. I was in the 80s with the leg warmers and the outfits and you name
And
it.
the stair step.
Yes, I was all in with all of that. But now at my age, it does not give me much for my health. I have had to face the heavier weights now, which I'm not going to say I love doing, but I know that's what I need to do. And I want to make good use of my time. So those are some of the changes that
Ironically, I
we
was
have to
a
do.
competitive strongman lifter, so this is me cheering you on lifting heavy weights.
Okay, good. I need it.
I love water aerobics now. I injured my back and I can no longer lift heavy, but I'm assuming that when you say lifting weights, what you're talking about is building muscle, which you can do with body resistance activities. You can do
Yes.
a variety of different ways, but we want to put skeletal support on our body by building muscle, and we do that by eating more protein and by doing some sort of resistance training, whether it's weights or body or anything like that. Is that
Yeah.
correct? Okay.
Yes. Yep. That's exactly right. Yeah. Yeah, for sure. It's definitely interesting because I still love my Zumba and I love my walks, but I now have to acknowledge the other things I have to do to keep my bones strong. All right. This is another area where even just, okay, low doses of estrogen are still the best treatment for bones and to preserve bone density. And so for younger women, I am always encouraging women to go get a baseline bone density scan. The US Preventive Service Task Force says age 65, and I think that's crazy. I think that's way too late. So for sure, let's say by age 50 or maybe even younger, if a woman has had any types of fractures or that sort of thing, to just get a baseline. Right. Another thing I want to be sure to remember to say for people listening and going, oh, especially because there's just still so many unfortunate, scary headlines related to hormone replenishment that are out there, that using low doses of bioidentical hormones does not commit a person to using them forever. And to me, life is about quality of life. It's worth addressing these symptoms. Critically important to preserve your sleep. That I just harp on it. I just come back to it all the time. And then, of course, there's the part that I can't help with, which is the sleep hygiene, the winding down at night, turning off screens, all those things that we know to do. Those are also really important. And also advocating for ourselves so that doctors don't say, "Oh, well, it can't be your hormones because you still have your period sometimes."
I can't even, like, the first time that someone, like, my regular, not my OBGYN doctor, tested my hormones and then, like, gave the reading back to me that's like, "It's fine. This number is fine." And I'm like, "Do you even know what your
Right.
information you're sharing? Like, you didn't even ask me what phase of my cycle was." I'm like, "I'm not coming to you for hormonal health. This is not your area of expertise.
Yes.
Please do not discuss this with other people because this is dangerous what you're doing
Yeah.
right now."
You're absolutely right. So since you brought that up, I just want to say that a good day to check estrogen and FSH is day 3. So day 1 is the first day of the period. So for a woman who's not having menstruation, it gets more challenging. We don't know where things are at in that cycle. So day 3 is a great place to check FSH and estradiol. That's checking what we call ovarian reserve. So the estrogen, the FSH they should both be low at that early part of the cycle. And then a good time to check progesterone level is in the middle of the luteal phase. And another thing I want to say, because I think your listeners are on the younger side, is that the luteal phase is the part that stays consistent. It's usually about 14 days and it stays consistent. So when a cycle is irregular, it's the follicular phase that's varying. The luteal phase, at least as far as we understand it up to now, we consider that it stays pretty consistent. So if a woman, this happened to me the other day with a patient, her cycle is regular. She's in her 20s, her regular every 35 days. So instead of mid luteal in a 28-day cycle would be day 21, but she needs to check her progesterone on day 28. Just a little extra
Interesting. Yeah.
detail for your listeners.
Learn something new every day. I want to talk a little bit about the community that you have where people can continue to learn more, but also come together and lean on each other as they go through second puberty, changes, transitions, all these words that we've talked about. Can you talk a little bit about that and what is available for listeners if they want to engage and learn more?
Yeah, absolutely. I'm very excited about this project. Our members are the Momos, the Miracle of Menopause online community. So our Momo community. This all came from my positive approach to this time of life. It's such a huge opportunity. I remember when I was getting ready to turn 40, I just bumped into somebody. I was at my brother's birthday party, and he's in his 50s. But there was a friend of his who's about to turn 40 who's not happy. I remember I was going to turn 40. I was not excited. But then once I turned 40, it was awesome. Same when I turned 50. All right. So, like I said, getting ready to turn 60 next year. So, yes, we have to address the problems that are happening, the physical changes and challenges. And it's just this huge opportunity. My kids are in their 20s, and I look back, it's like what you were talking about, seeing what our kids are facing with their challenges. I'll take the challenges that I have now, where I'm at now, personally, professionally, and what I get to design for my future. And so that was the gist of it. The programming that we're doing, the once a month, the live sessions, they're really going to be trainings. Not, we're going to have the community aspect. Men, of course, need that, but we women, we really thrive when we're connected with others. So we're definitely going to have that. But it's going to really be way beyond the women's health part of it. We're going to explore sex, relationships, finances, life purpose, where it's really going to go into all of those areas with this perspective that we get to have at this point in our lives.
And I always like to leave listeners with something positive and actionable that they can take away and do. And so I know we've talked about a lot of different things today. It sounds like joining your community could be one of those things to be able to tap in and remember some of these things as they come up and come forward in your life instead of feeling like, oh my gosh, I need to do all the things today. Are there other things that you think like, okay, if someone's listening today and they're like, I am just realizing in this moment that I need to do more. I'm going through this and I don't even know where to start. What would you suggest?
All right. Well, one thing that's occurring to me to say to your question is be the tail that wags the dog. Advocate for yourself. Take this knowledge and apply it to yourself. Okay. There's a doctor who said, I have the body of knowledge, but you have the knowledge of your body. And remember that a lot of the things that I see out there for empowering ourselves, to me, I'm lucky. I grew up in a family of strong women role models. And so that's when I see things encouraging women to really take care of themselves, put your own oxygen mask on first. You've never heard a pilot or flight attendant say anything other than that. And that is really, I think, a good message to leave on.
I love that I have the body of knowledge and you have the knowledge of your body. I'm going to remember that one. Love it. I want to encourage you listeners, you can check out and find out more at drlizmd.com. And I'll put a link in the show notes, but sounds like Liz, you have an ebook that you'd like to give to our listeners for free as well if they want to learn and read more.
Yeah, absolutely. This is the Miracle of Menopause book is coming, but the most recent book that I put out there that went bestseller is Go for Great, Dr. Liz's Guide to Thrive at Every Age. And GREAT is an acronym. The G is for gain knowledge, realize the truth about hormones, explore your expectations, advocate for yourself, and the T is for thrive. So it's a fun one.
I'll put a link in the show notes for listeners, but you can get access for free at drlizmd.com. And listeners, I want to thank you so much for being here today. If you've enjoyed the show, leaving a review is the absolute best way that you can thank us for the work. It helps other people find the show and doesn't cost you a single thing. As I always like to say, please remember to follow or subscribe in the podcast app that you're using. Like that person on YouTube, I'm like, you can subscribe. I feel like I need to put that throughout the whole show. But if you've enjoyed listening to the show in all seriousness, I guarantee you that you have other people in your life who are going through similar things and would appreciate the knowledge and information. So just copy from the three little dots in the corner of your screen, like share the link and send it to people, or leave a review and say, this is a great show. I learned something. It's super helpful. Thank you so much for taking the time to do that, listeners. And Dr. Liz, thank you so much for being here and for sharing so much knowledge and information with everyone.
You're
And
welcome.
listeners, thank you, because as always, I appreciate your willingness to be open to growth through your own personal changes because no one is perfect, but in learning and unlearning, we can choose to become better versions of ourselves for ourselves. And I know, Dr. Liz, you helped us do that today. So thank you so much.
My pleasure.
Listeners, I'll be back again next week. Have a great one.